Hi, this is Dr. Robert Antolak from the General Dentist. Our phone number is 586-247-3500. And what I'd like to talk about is the difference between a manual toothbrush and the effectiveness of a Sonicare type of brush, which is an automatic brush. So this is a model of teeth, obviously, and the areas where bacteria grow is right at the gum line. So bacteria is it's in everybody's mouth, and it forms in a condition something called dental plaque. Dental plaque builds up every single day from the bacteria that are naturally in your mouth. And these plaques, what they do is over time they accumulate, and so if you don't brush your teeth for a while, you'll actually feel like a fur that develops on the teeth almost. And that's the stuff that you want to get off for a couple of reasons. Number one is that dental plaque, if you ingest things like pop or candy, any type of sugary substance, it takes that plaque and it combines it, and it has bacteria in it, and it combines it with the sugar. That the bacteria uses sugar, and the byproduct is an acid. That acid, as it sits on the teeth, will actually dissolve the teeth and turn them white. So what we want to effectively do, as we all know, is to brush our teeth. Well, there's some confusion about where to brush teeth. Sometimes people think that they only brush the very tops of the teeth like this, but you don't affect the gums. Really, the reality is you want to brush your teeth where the teeth and the gums meet, and you want to go in that direction. If you do have a manual toothbrush, what you'll do is when you brush, you come up and you go like this. You kind of do small circles like this, and you go all the way around. So you start off in one end, and you go around, and then you continue around like this, and then you go on the inside, and you kind of do the same thing towards the roof of the mouth, and you use that angle, about a 45-degree angle, up to the gum line, and you go just little vibration motions like this, okay? And then you do the lower ones, and then you start off here, and you go on the outside, and you start in the back, and you keep doing this. And you create enough pressure so that you get between the teeth. You come around, and it's very important to get the very front of the teeth here, and then when you're done with that, you get the inside of the teeth like this, and then eventually you do that, then you brush the top parts of the teeth. Well, you can spend your time with a manual toothbrush, and that works. It's been working, but it doesn't work nearly as well as something that actually vibrates. We at our office at the General Dentist, we recommend the Sonicare brush. And the reason why we recommend the Sonicare is that it vibrates at such a high frequency that it actually penetrates into between the gum and the teeth, and actually vibrates and starts to vibrate some of that plaque loose from the teeth. So basically what that is you might not be able to hear it, but it does the work for you. You sit there and you just, all you have to do is hold it like this. That's all I do when I brush my teeth. Just like that. Come across and you just brush, you just hold it. That's all you have to do. The brush does all the work for you. So you do it the same manner that you would the manual toothbrush, but it's going to clean a teeth probably about, I would say, 5 to 6 times as much, if not more. And it doesn't also create the trauma. Sometimes I notice, in fact I saw a patient today, they had lots of recession on their teeth because she brushes like this, back and forth like this, right? And as that happens, over time, over a long period of time of brushing, that can actually start stripping away the gums and even the part of the tooth, creating more recession, which can be very damaging. Sonicare, for example, because you just hold it there in place, it does such small minor movements like this, but effectively cleans the teeth off. It's better, it's safer, it reduces the amount of recession that you can get from the trauma from brushing your teeth. So that's just a minor thing, but I feel it's important to talk about that. Our office number is 586-247-3500 if you'd like an appointment, and we're also at thegeneraldentist.com. Thank you. Have a blessed day.